Stroke is a medical emergency and quick action is needed to reduce long-term effect and increase the chances of recovery. Hello everyone, this is Nurse Mo from Rofel. Let's talk about cerebrovascular accident, CVA, also known as stroke or brain attack. A CVA is the result of an interruption of blood flow to a specific area of the brain. This can happen either by a blockage or rupture of a blood vessel. The interruption that results does not allow brain cells to get adequate oxygen and nutrient. Brain tissue can die from this, and eventually it can lead to long-term damage or even death. There are two types of stroke, hemorrhagic or ischemic stroke. Let's look at ischemic stroke first. Ischemic stroke happens due to a blocked artery. Ischemia is when cells start dying from lack of blood flow or blockage. A blood clot or a plaque that breaks off from atherosclerosis can lead to an embolic stroke. An embolic stroke is a type of ischemic stroke. When there is a mass like a tumor around a blood vessel, it can press on the blood vessel and then reduce or completely stop blood flow, and that will lead to ischemia. Hemorrhagic stroke, on the other hand, can be caused by ruptured blood vessels or aneurysm. Uncontrolled hypertension or too much blood thinners can lead to hemorrhagic stroke. There are risk factors. Some of them can be changed and some you cannot do anything about. A very huge risk factor is uncontrolled hypertension. Sustained hypertension can weaken blood vessel and it will lead to vessel rupture. High cholesterol increases the risk for developing atherosclerosis. Atherosclerosis is a major cause of a stroke because it can increase the risk of blood clot or a plaque that breaks off and becomes emboli. When someone is diagnosed with an aneurysm, the aneurysm can rupture and that can lead to a stroke. Atrial fibrillation is a common cause of embolic stroke. In atrial fibrillation, the atria are not contracting, and that allows blood to clot. The clot can become an embolus, enter into the aorta, and go straight up to the brain. Smoking and cocaine use can increase the risk of a stroke by causing vasoconstriction, hemorrhage, and ischemia. Diabetes and obesity also increase the risk of a stroke.